relationship between micro and macrovascular disease is it's a very important one, because anytime you watch out for a patient with macrovascular disease, you should also look for the microvascular, because it's very common. And of course, the macrovascular disease means changes in the large vessels and the small vessels. That's the microvascular disease, but they go together, and that is very important. And for instance, when we look at the big outcome trials, you can see in those that you can see also an effect on the macrovascular disease. Very often you also see an effect on the microvascular. Yeah, that's it's an important point to address the effect on micro and macrovascular disease. And let me explain this, because if you look at the old UKPDS trial that was done many years ago in newly diagnosed diabetic patients, and the idea was to reduce the A1C and see what can we achieve in terms of less cardiovascular and less microvascular complications. So they achieved a 0.9% reduction in A1C. Now what they saw, dramatic effects on the microvascular side, but nothing on the macrovascular side. Now, after the closeout of the UKPDS, all the A1C values merged. So after another 10 years, there was still the effect on the microvascular side, but there was also an effect on the macrovascular side. So it tells us that if you want to achieve something with the good glycemic control, it takes a long time to achieve it on the macrovascular side, but shorter time on the microvascular side. And now it's very interesting that when you look at all these big trials out there, very often you see an effect on the microvascular side, and even more immediate than on the macrovascular side. So again, they go together, and it's easier to get some results on the microvascular side, but it takes a little bit longer time on the macrovascular side. The good news is now that we have newer medications that you can address the macrovascular side much earlier, and you have immediate effects if the patients have established cardiovascular disease. We haven't seen any data yet on if you don't have established cardiovascular disease. What I would say is that when we look at the big trials, for instance, the EMPA-REG outcome trial, the CANVAS program for SGLT2 inhibitors, and if you also look at the LEADER and the SUSTAIN 6 trials for GLP-1 agonists, where we have seen an effect on the macrovascular side. So in the EMPA-REG, there was a 38% reduction in the cardiovascular death. There was a 35% reduction in risk of ending up in hospital because of heart failure, and also reduction in all-cause mortality. So wonderful effect. This study, the EMPA-REG, as also the liraglutide study, the LEADER, that also showed similar effects on the cardiovascular side. They were not designed to look at the effects on the microvascular side, but both studies, the EMPA-REG and also the LEADER, they had the pre-specified renal events. So renal events as a measure of microvascular disease. So they could look at the microvascular side in terms of renal effects, just because they met the primary outcome. And what they saw in both trials, actually not only empagliflozin, the SGLT2 inhibitor, but also liraglutide, the GLP-1 agonist, not only reduced the cardiovascular death and cardiovascular disease, but also reduced the risk of progression of renal disease, onset of new renal disease, and even reduce the risk of ending up on dialysis.